The honourable member from Calgary-Fish Creek.
Well, thank you, Mr. Speaker. Last Thursday's throne speech said, and I'm going to quote, "The government will design and implement a plan to extend the province's network of continuing care centres so seniors can find accommodations that suit their budgets and family arrangements." My questions are all to the Minister of Health. Minister, what regulations or standards exist on patient-staff ratio in both public and private continuing care facilities?
The Honourable Minister of Health.
Mr. Speaker, the honourable member referred to two new continuing care centres that were announced last year. We're very proud of those, Mr. Speaker, because they are going to facilitate complete ageing in place for seniors from a very independent level of living right through to long-term care and palliative care. With respect to standards, as I said earlier, Mr. Speaker, the standards that are in place in Alberta, the healthcare standards and the accommodation standards apply to all operators. Again, rather than an ideological basis for the standards, Mr. Speaker, our goal is to ensure that residents receive the appropriate level of care in the appropriate place at the right time. We will continue to design our strategy along those principles.
The honourable member.
Well, Mr. Speaker, I don't know what spaceship he's on, but he's not on this one. So, you didn't answer the question. Who is responsible for implementation of the continuing care health service standards to ensure seniors receive the care that they so richly deserve?
Honourable Minister.
Well, Mr. Speaker, I am certainly not on that spaceship, but what I will tell you is, as I said in the answer to the earlier question, that the healthcare standards apply to all. The healthcare standards are set by government. They are done so in consultation with stakeholders, including residents, Albertans who use the system. We will continue to apply the principle of providing the appropriate level of care to the resident in their particular circumstances. Thank you.
Thank you. Honourable member.
Thank you, Mr. Speaker. I'm going to go back to question one. What regulations or standards exist on patient-staff ratio in both public and private continuing care facilities?
What's the number?
That staff ratio. Is it 1 to 140, 1 to 60, 1 to 40?
I don't know what the Honourable Minister.
Well, Mr. Speaker, the information on continuing care health standards is public. As the honourable member well knows, it is available to her to refer to and to comment on as she wishes. With respect to particular patient-staff ratios, there are various places in legislation and regulation that one can look. But again, Mr. Speaker, the guiding principle for this government will be to provide the right level of care for the right resident in their appropriate circumstances.